Be informed. Be alert. The information you need to know about COVID-19 vaccine. Right here, right now, on The Vax.
Sometime in March of this year, we heard of news, especially in Europe, where a vaccine, specifically in AstraZeneca and Oxford University developed the vaccine, where a group of people nag-develop some clots, specifically sa brain. If you look at these reports, ano nga mga form of clotting ang natabo? Actually, the form of clotting na natabo were cerebral venous sinus thrombosis. In itself is a rare form of clotting sa veins sang brain naton. And it is thought nga ang reason sina is that ang vaccine nag-trigger sang immune response producing this clotting factors and clotting disorders. But right now, what do we know of that? Of more than 34 million people who are already injected by the vaccine, the incidence of clotting is 0.00005. Tamaan siya kanubo. So, you ask me, ano yung incidence ng clotting kung manigarilyo kita? The incidence of clotting caused by smoking and nicotine is higher than the incidence of clotting na matabo from the vaccine. So, meaning mas delikado. Kung nakulbaan ikaw sina, you would look at the risk-benefit niya. Clearly, the benefit of receiving the vaccine far outweighs the risk nga basi magka-clot ikaw. That's why the vaccine is resumed and is given currently. So amo malang sina ang mga reasons sina kag like ako tapos na ako vaccine and of course as a person, as a human, isa man sa mga hesitations ko, but you have to look at the data. Do not just rely, I will try to be as scientific as possible, Ma'am, balang kita may ara or wala? May ara. Ano siya kadamo? So you have to look at the evidence, You have to look at the mas dako ba lang benepisyo nga makuha ta sa bakuna? Clearly ang answer, oo. Far more beneficial than the risk nga makita nato. Because ang bakit nga clotting, it depends kung di nagsupon ang clots, And as a neurologist, I would be looking for signs and symptoms of focal neurologic deficit, stroke-like symptom. But as of now, wala pa man kami sang nabalitaan, especially diri sa aton, nga nag-stroke because of that vaccine. In fact, kadamuan nga pasyente nag-stroke because of COVID, not of the vaccine. So, if makita man na nila nga after nila bakuna, there is vaccine education and monitoring na kung ma-feel nila nga may mga simptomas hindi nga ara sa checklist, they have to proceed immediately to an emergency room and the institution is tasked to report to the vaccine committee nga may mga amo sini kaglantawon naton kung vaccine related bala siya o kung hindi.